Good day, everyone. This is Chibuzo Ibe speaking. I'm currently a student in Duke's University under Coursera studying AI Product Management Specialization, and currently this is project 3 for Human Factors in AI, course 3 of the Project Management Specialization in Artificial Intelligence in Duke University. So here we have a project that was given to us by the lecturer. So here are the guidelines of the project, and these other reports over here are my project reports made for the project. So the project is basically to talk about tax analysis, user experience, privacy consideration, and ethical considerations as follows. So I'll be analyzing my previous project from the initial managing um, products from the previous lessons in course 2, but I'll be using that as an extensive consideration and also continuation in this project 3. So here we have basically my tax analysis involves the problem. Basically, it's all about to evaluate and predict disease progression during an endemic, epidemic, or pandemic period. That is my task that I want to analyze properly. So basically, it allows the disease outcome to be known before the disease becomes severe in order to prevent death as much as possible or prolonged hospitalizations in the community environment or a specific country. So here, the key tasks required or key tasks to identify within the problem or the model we're trying to create and use for prediction is one, the users specifically are the health practitioners and medical researchers. They are the main people using the features or using the model or the system. The task basically is to evaluate and predict and prevent, or rather predict diseases progression before it advances to an endemic or epidemic or pandemic period. So you are to evaluate, to prevent or predict disease progression as much as possible using the model or system. And now to analyze the task, there are certain things we have to break down or we have to do in order to analyze the task or rather to make the task successful. The triggering factor is identifying the symptoms in an outpatient clinic. When someone brings or presents with the new symptoms that has not been analyzed before, or symptoms that is looks like is a recurrent thing in clinics, it becomes a thing to analyze. The next action following that is proper investigation and isolation of such patients. And the ways of carrying out the investigations, and also in most cases, can be through electronic health records, diagnostic apps, or medical consultations can be used for the analyzation of the entire task. Basically, if most patients are not requiring admission into a hospital setting. And the next thing is your decision making on what to do, which may require multidisciplinary team approach, depending on how varieties of symptoms may be. Could be from the brain to the heart to the kidneys. You would like to have a multidisciplinary team to manage such patients. Then the next thing is your action. What to do next is outlining a management plan for the patients and see how it works out. Then the next action is to commence management after or prior to taking investigations, or rather investigation being sent or reviewed, which also aid in appropriate management plan um, potential. And then the decision is the next line, which is to review the current clinical state and determine further management depending on how the outcome has presented itself, or how or what is the progression of the disease or the severity of the disease. The objective basically overall is to ensure that disease does not spread or result in further outbreaks in the community or specific country. Now, to simplify the task flow, patients will have to be counseled appropriately on their clinical findings, and they should be ensured and reassured about possible outcomes. Also, the data that will be collected, patient needs to be informed about data collections using their clinical findings, which will be used in the research, the prediction, and compilation and analysis as well. Then number two report is the user experience, the user flow. Now, the user interaction with the solution, how they interact with the solution is very important because it also will determine how much data you can collect and how the prediction will flow or will go. Now, outpatients, one, to collect enough data, you need to be in an enclosed environment with the participant or the patient. Outpatients with severe symptoms, which are likely to be the study group, will be admitted following their clinical findings. Investigations will be carried out. Data will be used to decide the severity or how far the severity will go, and if progression to an endemic or epidemic or pandemic is possible, which is what we are trying to prevent or control based on our prediction and now using our model. Then other things to look at is according to the consideration of the artificial intelligence product user experience, we have things like user input, transparency, communicating uncertainty, and feedback loops. Those are the four criteria under consideration of AI products for user experience. So number one is the user input. User input involves data collection, which will be done through forms for most outpatients, such as Google Forms. Okay, and then following that, data will be inputted for evaluation, comparison, and then prediction using our system and model, which will decide if one, the outcome of the patient will be worst. Number two, if the patient is likely to be a source of spread to other individuals or persons otherwise. Then transparency, patient also will likely or will be adequately informed if admission is required based on our data collection or our clinical findings. So with that, we'll decide if patient requires admission because if patient is a likely candidate for transmission or spread, they need to be admitted and isolated in order to make sure that a prevention of an epidemic, an outbreak, or a pandemic is reduced as much as possible. Now, they will be carried along each management options and daily or weekly outcomes will also be known. Then, other thing for the AI consideration in products for product user experience is that you have to communicate on certain things through making sure that the patient understands the probability of the disease, having a good outcome of prognosis will be communicated if possible, and possibility of predicting outcomes that may be faulty or contain errors has to be emphasized to the patient or the participant that the data may not be overall correct, but as much as possible, you would like to still proceed in order to get a better outcome for the patient. And feedback loops. Collecting feedback from the patient is important because it allows you to know if your model or system is performing adequately or needs to be readjusted. So collecting feedback from the patient or patient hospitalized should be prioritized. And depending on what the feedbacks based on whatever they give, that will determine how the model is functioning or how well the model is being used or is functioning for such for what is being created for. And also understanding the pain points and needs of the patient should be a priority because that will tell you more about why their feedbacks was what it is. Whatever was said or whatever was given will make you understand why the feedback was that after you have understand the pain point of the patient, especially those patients that may not be satisfied with the performance of the model or the system. Now, privacy considerations. We have to consider privacy when collecting data, which can be sensitive. For most data, or basically almost data are sensitive, especially when it has to do with people. Now, we have to avoid leakage of personal identifiable information, PI, which may involve the patient's or participant names, addresses, contact details, previous history, or medical records, which is very, very important because such information is regulated and has to be under tight monitoring. Then, use of data in the artificial intelligence system has to do with that. The probability that a large data will be required is very obvious because such a massive model you are trying to build, which enables you to evaluate, predict, and to prevent an outbreak or control a possible outbreak, is going to require a large amount of data for training and large data training sets in order to be able to ensure that predictions might fall under the required categories. And then for the large data, it has to be cleaned in order to prevent or avoid leakage and sensitive information and failure of predictions. Unclean data may lead to leakage of sensitive information and failure prediction, because there will be a lot of errors in it and also a lot of similarities, which likelihood you won't want to use all similar features. You want to use the same features to ensure that the training is successful and the model or the system being built is able to predict a possible outcome for different individuals. So at the same time, you'll be avoiding biases, which we'll discuss as follows. Then mostly the law that applies to my product or to my model, it's HIPAA rules, which basically applies to my product, and the obligation is as follows. The HIPAA rule will allow me to be able to use PIH for treatment and operations and possible research. And also, it will allow patients to access their PIH. That's one of the things about HIPAA regulations. It allows me to use the PIH for treatment and operations, allows patients access to the PIH, and also to ensure privacy compliance and adequate monitoring of compliance, meaning that compliance should be monitored in all sector from data collection up to the deployment of the system. Compliance has to be ensured in order for the prediction of the model to function appropriately and to be successful. Then ethical consideration, patient bias is likely to present from data collection, most likely, because depending on the team you are working with or the group of individuals working with, uh, uh, um, they have to really understand what the model is all about and the system is all about. So that can lead to bias on its own at first, which can be a representational bias with or without, or associated with a historical bias. It can or both occur together. So that has to be looked at for when looking at the ethical considerations in potentially using the patient data and also incorporating AI features for the model. Now, the goals of the ethical artificial intelligence, there are three goals we are trying to achieve: fairness, accountability, and transparency. Now, under the fairness, likely the patient with similar symptoms and duration will likely have the same outcome and will be classified in the same group in order to avoid possible errors. And also, they decide how much data will be used from such group. Then, accountability, model performance will be monitored by health practitioners and as well technical support team, which are helping in incorporating the AI into the model and in order to ensure efficiency and avoiding failure of the model system. Patients have the right to request evaluation if the system does not meet the standards set by HIPAA. Basically, if the patient does not understand or like the possible outcomes being given, they have the right to request a evaluation of the model since their data is being used for possible training as a regulation which is set by HIPAA itself. And lastly, the transparency. Patients would have access to their data and model functionality. They will have access to everything the model system has to offer. And then the model that is created should or would be simplified and should be interpretable as much as possible for every patient and every users of the system. So this is all about my um, model system based on the current project, which has to do with the task analysis, the user experience and user flow of how the system should work, the privacy considerations, and lastly, the ethical considerations for the model or system. Basically, all I'm trying to do is to be able to evaluate, prevent, or predict disease progression during an endemic or epidemic or a pandemic period as much as possible using a based build system through research and also incorporating artificial intelligence into the system to ensure that it is well trained and ready for use by all participants or patients nonetheless. Thank you for your time and have a wonderful day. Thank you.